Oh, hi. My name's Andrew Nichols. I've been suffering from migraine for about 10 years now. I think the first migraine I can remember was probably just as I started secondary school, around that time. But it's sort of, I just remember it just being like a really pulsating pain sort of thing. And just having to go to bed with it a lot. And I think throughout secondary school and stuff, and throughout up until sort of sixth form time, I would have to go to bed a lot with migraines and stuff. They did improve in the sense that I got less ones that made me go to bed and stuff like that, but I still had the same frequency sort of thing. So
you got better at dealing with it, didn't you?
But I did get better at dealing with it as well, because you have to like get used to and like get over it in a way, and like just get on with your life as best you can. But obviously like it puts a dampener on things. Yeah, I'd just say the way it affected me most was the fact that you missed out on things, and the sense that you felt kind of different from everyone else in your school or whatever. And then as I'm growing up and going to university and that, just it stopped the amount of nights out I could go on, do stuff with my friends, like go on holidays and stuff, as I'll be worried about how many migraines I'll get. And it just makes you feel a bit like you've got an extra struggle in your life sort of thing. But yeah, I say they're the main ways it's affected me.
And with studying and essays, wasn't it?
It obviously, studying and stuff, it got in the way, it made it in a way that like I'd study all the times I felt okay, and then all the times I didn't feel great, I would like, it would be wasted time sort of thing. So I ended up doing mostly studying and not going out and doing things. But yeah, I think.
And the medication at first wasn't good, was it?
Sorry, I say, and that's another thing is all the medication that I've had to take over the years, that makes you feel a bit sort of like not an invalid, but a bit like you're different, and then you're not sure what medications are working, what ones aren't, if they're making it worse, what the side effects, because some of the tablets, they affected my stomach and stuff like that, so it wasn't, they're never like 100% perfect. They always have some sort of side effect or some way that they make you feel not how you should sort of thing. So sometimes the side effects can be as bad as the benefits. So you just get a bit, you get a bit despaired with the whole thing. Like I remember I quit in the end all my medications about a year ago, just under a year ago now, just because it just makes you feel like you're taking all these pills, you don't know what they're doing to your body, and it just makes you feel like you might be damaging things as well. And as I said, it's just all the side effects that they all have. And
when you came off the propranolol, you had.
Yeah, and I remember when I came off the propranolol, it felt really horrible for a while. I had really bad migraines and stuff, and sort of like my heart it felt like it was erratic or whatever, and I just felt quite
palpitations,
panicky and that, so it wasn't great. So they're never a healthy option to do, taking medication, but now it seems with the whole surgery and everything that I won't have to go back to medication, because it seems like the pain is being reduced all the time, so it's really good. I'd just like to thank everyone here, really.
I'm Andrew's mother. And Andrew's been suffering from migraines for 10 years. We're from London. In the first year at secondary school, in order for him to cope with the headaches and the change of regime, because it's very different going from primary school to secondary school, he took lots of ibuprofen.
I did, yeah.
And as a result of that, by the following year, he also developed IBS, which I think is also because of the
result of taking
overuse of medication.
Yeah, all those medication for about a year. So, yeah.
And the thing in the UK is although there's just not much help for migraines or headaches or even IBS. You're given medication, and if that doesn't work, they either want you to increase the dosage or else they want you to try a different drug.
I was going to say about there's not enough regulation as well, because I was like, as I said, you're taking painkillers. I stopped taking them because I realised it was not doing good. But I mean, I was about 11 and I was probably taking 14, 15 painkillers a day. So I think that really did, after about a year, my stomach just sort of messed up, and I wouldn't be surprised if it was down to all of those painkillers every day sort of thing going through you, and you don't know what they're doing to you really. That's true. Just all these like sort of codeine, ibuprofen, paracetamol, and it's just because I don't know, like if you're in pain or whatever, sometimes you'll hide the fact that you're taking all these pain medication from your family, so you might just like I remember I just like take 2 or 3 without my mum knowing that I'd taken 2 or 3 painkillers, so it wasn't great. So it does drive you to really desperate measures sometimes. So,
and also in the UK, it's very polarised. The headache neurologists just look at the pain in your head, and the drugs they prescribe don't necessarily suit your stomach. Yeah,
they don't tell you of the side effects.
Although they know you've got IBS, they're not really interested in that bit. They're just interested in dealing with your head. And you're just part of a process, really. Yeah. So here it's been really good to have the holistic approach, hasn't it?
Yeah.
To look at the whole overview, because obviously seeing a neurologist, they were just looking from a neurological point of
and
view.
And it's just what Dr. Shevel was sort of telling us in the car, they got their sort of one opinion about how migraines work, and they won't change
deviate
at all. Even though like more and more evidence that this will work or that will work, they won't look at it, sort of thing. And it's just quite frustrating. They're quite archaic when it comes to certain things like migraine. Because I know with certain diseases you feel like they're making a lot of progress, but certain other ones, especially like chronic pain conditions, a lot of the time they don't seem to get their investment, or they don't seem to look at new theories that come across as much as they should.
And it's also quite difficult as well. They tend to make you feel it's psychological. They want you to see somebody and go for counselling.
Or like pain,
I'll say, how are you feeling
things.
Depressed? But the depression is just because you can't do the things and you're not making any progress. I mean,
and then you end up saying, I'm not depressed, even though because you are depressed because you're getting a lot of pain, so you obviously are depressed, but you don't want to say you're depressed to them, because it's kind of like, then they'll be like, oh, see all of these people, or see this counsellor. But it's kind of like, even if I was to tell you what my problem was and stuff, it's not going to solve the problem itself. So it wasn't, nothing they did seemed the right way. I just remember, I think it was just one day I was just feeling in my head and realising that when I did press down on a nerve, it helped. But I didn't think anything of it, because I didn't know it meant anything. But when I remember coming across this and then them talking about it, and I was thinking,
YouTube, wasn't it? Yes.
Yeah, and I was thinking, actually, this sounds like something that makes sense and could work. So yeah, I think that's when we got interested in it, wasn't
that's
it?
That's right.
Really,
Andrew was in the States on a year's exchange, weren't you, when you first looked it up?
Yeah.
And then when you got back in May.
We sort of thought about it further. So yeah.
That's right. And Dr. Shevel was very helpful answering some of our questions.
Yeah, because I know, because obviously before you come, you want to know all the answers to questions and stuff, because obviously it's a big thing coming so far from a different country. So yeah, but he was really helpful with all the questions.
That's right,
and
everybody here has been really, really helpful.
Yeah,
and it's really nice, because Andrew, you can feel his personality coming back, because when he's so under a lot of pain, he keeps going. But obviously, when the pain's better, he's much more alive, aren't you? And more his own personality.
Yeah, it's just sometimes you feel like you just. That's another thing. It's sort of like robs you of who you are in a way, because it's kind of like when you're in pain all the time, it's like, you don't feel you can be your normal self in a way, or you don't even realise you're not being your normal self. But then when you're not in pain, you realise, oh, actually this is how I normally am, like this is how I am without pain, sort of thing. So it's
and I feel
good.
sorry for Andrew with his friends, because he's under pressure because they want to go out with him, and he can never definitely say that he can do it.
Yeah, because I've got quite a lot of friends and stuff. There's a lot of people who be like, oh, do you want to come out here? Do you want to come out there? And it's like,
and he feels he's letting them down with the pain.
Yeah. I feel like, oh, I don't want to be the guy who's always letting people down. Like, oh, I'm the guy who's never going out or whatever. So it does feel kind of bad in that way. So yeah, it is quite hard in that sense. I say the main thing now, that the hardest part of it is the feeling that, oh, I'm missing out on this or I'm missing out on that. Or if you do go to a thing, you're not feeling your best and you feel like, oh, it would have been better if I'd been feeling good, sort of thing.
Yes.
So, yeah, I think, that's the main
But
thing,
definitely
really,
just from this week, even after the surgery and everything, you're feeling so much better, aren't you?
Yeah, my head just feels it just feels clearer. Like there's not so much, like it's not like you've got some pain here or there or whatever. You can think. That's the thing I hate with headaches, is you don't feel like you can process your thoughts properly because your brain's hurting. Whereas when it's clear, you just realise how much more clarity and thinking you have.
Yes, because you can certainly really seem quite spaced out at times, can't you?
I just get really sort of spaced out, like I can't concentrate on anything. Whereas when your head's clear, you can like focus on stuff a lot more easily. So it's good.
Yeah,
really,
and it's always been really hard with his end of year exams and things, hasn't it?
It's just an added stress that like, oh, I don't want a headache in the exam, or and then you might like take a ton of pills and then I might get a stomachache or something.
Yeah, but that's right.
It's just like a revolt. Like it's really like one of those things where it's a catch-22. You don't know what to do when exams come. You just got to take a risk, hope it goes okay.
And it was worse when he was in the States, wasn't it? Because they had continuous assessment in all 4 subjects all the time.
All the time. So it was like
every
constant
week.
Stress.
So
because it's like they had you would read sort of like 1-2 books for a subject, and then you'll do an exam in that subject every week. So you'd be doing about 2 exams every week, and then you'd have to read about 3 books for those exams, and it's just like there's a lot of pressure and stress because it's continuous, which made it even harder really, because at least with the way it works in the UK, when you've got exams at the end of the year, it's just that one section of pressure. But when it's like continuous, it sort of like gets to you after a while when you're suffering a lot of pain as it is. So yeah.
So yes, no, we're really really pleased how
we
we
are pleased. Yeah, definitely.
And although we had to think a lot about coming for his health and happiness and future, it's just been
worth it. Yeah,
excellent.
It's been great.
And everybody's been so helpful.
Yeah, everyone's been nice and everything, because you feel a lot of the time like that people, they just want to, once we've been to like some other people before we heard of the headache clinic, and you find with a lot of places or the NHS that you're just sort of like a problem to them, and they don't you feel like they don't really want to help you out.
Yes, they're pleasant, but then if your problems don't
go away instantaneously,
or
they're like, they get a bit fed up with you.
As if you're attention seeking, and also Angie's also gone privately for tried some Botox treatment, didn't you?
Yeah, and it was just the way he just sort of did it in 5 minutes.
That was in London, wasn't it?
Yeah, that was it.
And and that just seemed really extortionate, and there wasn't much follow up, and it didn't really work. I can't remember the name of the surgeon, but he this has just been wonderful, hasn't it? It's just been such a nice holistic approach, and Andrew's been able to come. We've been able to come in every day, and it's really good.
Yeah, no, it's been good. Thank you.
Thank you very much.
That's it. Okay.
Wow.